Senator Braun.
Here we are again on a very familiar topic. I just left the Aging Committee, and it was about healthcare transparency. All the gimmicks insurance companies and hospitals employ in a market that lacks it completely. And even becomes a bigger issue, of course, the older you get, because you're going to engage the healthcare system even more. I think it does operate almost like an unregulated utility. I've said it so many times, I almost feel like I'm getting blue in the face saying it, but the industry has never had to comply with any of the normal features that make a market out of something, which is full transparency, an engaged consumer, no barriers to entry, and yes, price transparency. Every other industry deals with it. We don't have it here. Senator Sanders and I have introduced a bill that tries to be as global as it can get to put this into play. I know it can work. Wrestled with it in my own business. There was nothing on your P&L that was harder to control than healthcare. And this was back in 2008, and the company was 1/5 the size it is now. And if I had not tackled it in an entrepreneurial way to, number one, engage the healthcare consumer. For those that can afford it, they need to be out there shopping around, dealing with you like you would if you'd buy a big screen TV. I know many people would travel 50 miles to save $50 on a $1,000 item. Well, we don't have any of that dynamic. And it's sad on what is the largest part of our GDP that we got to wrestle with it like we do. The reason we have medical debt is because it costs too much in the first place. And until we reform the industry, and in any other kind of industry that's a monopoly or an oligopoly, it's called a utility. And utilities get regulated. If the industry doesn't wake up, that's exactly what's going to happen. Sadly, that's kind of where it's gone in almost all other countries. That gets the cost of healthcare down to closer to 10 to 12% of our GDP. I'd like to ask Dr. Bai about what would happen if healthcare was in that realm of full competition, transparency. Can we fix it? Or is it too far gone to where you'd have to do what many other countries have done? You know, it's a one-payer system. Because that's what happens. That's what a utility is. You sooner or later are going to get regulated by government. Are we too far gone, or can the system still be fixed?
No, we are not.
Tell me why we can get this bill passed and maybe start cracking the industry to where it's performing like most other segments of our economy.
The Braun Sentence Bill is an amazing bill. The details in that bill ensures price transparency and promote competition, and more importantly, in the short run, can make sure medical debt and the medical billing integrity is preserved. So in the short run, we know the numbers are right on the medical debt. In the long run, think about the three things. Number one, patients, right? Patients will have more control of their medical care dollars, and they can shop around, can benefit personally directly from lower price and higher health, not higher health insurance, but higher health status. But then the employers will get all the freedom, get a flexible design of their benefits. So they can just have more freedom to fund or purchase healthcare for their employees. And number three, more importantly, the physicians will get all the freedom to innovate and deliver care. So we have all the innovation for both care delivery, for innovation in medical care, as well as in how we design the benefit. So eventually, this system will work because it relies on two important forces. Number one, on the buy side, people want the cheaper and better things, including healthcare. Then on the sell side, all the innovators and providers, physicians, want to make money, but in this process, they innovate and get the best things for consumers.
Well, thank you. And before my time runs out, to me, this would be the most transformational bill that I've seen since I've been here. And I know how hard I worked on it to fix it in my own company. It can be done. sooner or later, the industry is going to have to wake up and get with it. I want to say, shout out who else is on it. Bipartisan quickly. Senator Smith, Senator Hickenlooper, Senator Grassley, Senator Coons, Senator Hassan, Senator Ernst, Senator Baldwin, Senator Warren, Senator Fetterman. Every senator in this U.S. Senate ought to be for taking the biggest sector of our economy and turning it into something that's going to be responsive to healthcare consumers. Thank you, Chairman Sanders.